Artificial intelligence is now predicting which children will develop type 1 diabetes years before symptoms appear, and it's happening through one of the most ambitious medical studies ever conducted. The TEDdy protocol is revolutionizing how we understand and potentially prevent childhood diabetes, using AI to analyze data from thousands of children followed from birth to adolescence. This isn't just another medical study. It's a glimpse into the future of personalized medicine, where AI doesn't just treat disease, it predicts and prevents it. Welcome to AI Radar. Today's video comes as a special request from a TEDingo C7478 on YouTube, and we're exploring how artificial intelligence is transforming one of medicine's most challenging puzzles, type 1 diabetes in children, and why this breakthrough could change healthcare forever. By the end of this video, you'll understand what the TEDdy protocol actually is, how AI is being used to predict diabetes years before it develops, and what this means for the future of preventive medicine. To understand the magnitude of this achievement, we need to start with the problem itself. Type 1 diabetes typically strikes children suddenly, often requiring emergency hospitalization when parents first notice symptoms. By that point, the child's immune system has already destroyed most of their insulin-producing cells. For decades, doctors could only react after the damage was done. But what if we could see it coming years in advance? That's exactly what the TEDdy protocol set out to discover. TEDdy stands for the environmental determinants of diabetes in the young, and it represents one of the most comprehensive medical studies ever undertaken. Starting in the early 2000s, researchers began recruiting newborn babies from 6 countries, including the United States, Germany, Finland, and Sweden. But they weren't recruiting randomly. They were specifically looking for children with high genetic risk for type 1 diabetes. Here's how it works. When babies are born, researchers screen their genetic markers, specifically something called HLA genes, to identify those most likely to develop type 1 diabetes. These high-risk children are then enrolled in a study that follows them intensively for up to 15 years. Every 3 months for the first 4 years, then every 6 months thereafter. These families visit research centers where scientists collect blood samples, stool samples, nasal swabs, and detailed questionnaires about the child's environment, diet, infections, and daily life. The scale of data collection is staggering. Researchers are tracking everything from what these children eat and drink, to every infection they contract, every vaccine they receive, even changes in their gut bacteria over time. They're monitoring for the earliest signs of diabetes development by testing for specific autoantibodies that appear in the blood years before clinical symptoms emerge. When a child's immune system starts attacking their insulin-producing cells, these antibodies show up like early warning signals. But collecting this massive amount of data was only the beginning. The real breakthrough came when researchers realized they had created something unprecedented, a treasure trove of longitudinal data that was perfect for artificial intelligence analysis. Traditional statistical methods simply couldn't handle the complexity of all this interconnected information. That's where AI stepped in to revolutionize everything. This is where the story gets truly fascinating. Artificial intelligence algorithms can now analyze genetic risk scores, autoantibody levels, environmental exposures, and family history simultaneously to predict which children will develop type 1 diabetes and when. These aren't simple statistical models. They're sophisticated machine learning systems using techniques like survival analysis and random forests to process thousands of variables at once. The AI doesn't just look at whether a child has high-risk genes. It considers how those genes interact with environmental factors like viral infections, dietary patterns, and even gut bacteria composition. The algorithms can identify subtle patterns that human researchers would never notice. finding connections between seemingly unrelated factors that contribute to diabetes development. For example, the AI might discover that children with specific genetic markers who experience certain respiratory infections during particular seasonal periods while consuming certain dietary patterns have dramatically higher diabetes risk. These complex multi-factor interactions are exactly what machine learning excels at identifying. The results are remarkable. These AI models can now predict diabetes development years before clinical symptoms appear, with accuracy rates that far exceed traditional risk assessment methods. Some models can identify children who will develop diabetes within 2 years, with over 90% accuracy. Others can predict 5-year risk profiles that help families and doctors prepare for potential diagnosis. But prediction is just the beginning. The real power lies in what researchers can do with these insights. This represents a fundamental shift toward precision medicine for type 1 diabetes. Instead of waiting for symptoms to appear, doctors can now identify high-risk children and potentially intervene with preventive treatments. Clinical trials are already underway, testing whether early intervention can delay or prevent diabetes onset in children identified through AI risk prediction. Some studies are exploring immune system modulators, others are investigating dietary interventions, and some are testing whether specific probiotics can modify gut bacteria to reduce diabetes risk. The AI systems are also revealing environmental triggers that contribute to diabetes development. By analyzing data from thousands of children across different countries and climates, the algorithms are identifying specific viral infections, dietary factors, and environmental exposures that increase diabetes risk. This information is already influencing public health recommendations and preventive strategies. What makes this even more impressive is how the AI handles the sheer complexity of the data. The TEDdy study generates millions of data points from biological samples, questionnaires, and medical records. Traditional analysis methods would require researchers to make assumptions about which factors are most important. AI analyzes everything simultaneously, letting the data reveal its own patterns without human bias. The machine learning models are also getting smarter over time. As more children in the study reach adolescence and their diabetes status becomes clear, the algorithms learn from these outcomes to improve their predictions for younger participants. It's like having a crystal ball that becomes more accurate with each passing year. This technology is already expanding beyond the TEDdy study. Researchers are applying similar AI approaches to other autoimmune diseases, trying to predict conditions like celiac disease, thyroid disorders, and multiple sclerosis before symptoms appear. The principles learned from TEDdy are becoming a blueprint for preventive medicine across multiple conditions. The implications extend far beyond diabetes. This represents a new paradigm in healthcare where AI doesn't just help doctors treat existing diseases, it helps prevent them from developing in the first place. Imagine routine genetic screening for newborns combined with AI risk assessment that guides personalized prevention strategies throughout childhood. Parents in the TEDdy study already report that knowing their child's diabetes risk helps them make informed decisions about diet, healthcare monitoring, and lifestyle choices. Even when AI predicts high diabetes risk, families feel empowered rather than helpless because they can take proactive steps and prepare for potential diagnosis. The technology is also revealing surprising insights about diabetes development. AI analysis has shown that type 1 diabetes isn't just one disease, but likely represents multiple different conditions with different environmental triggers and progression patterns. This discovery is leading to more targeted prevention and treatment approaches. Healthcare systems are taking notice. Insurance companies are exploring how AI risk prediction could influence coverage decisions and preventive care recommendations. Medical schools are incorporating AI-powered risk assessment into their diabetes education curricula. Professional medical societies are developing guidelines for using AI predictions in clinical practice. But perhaps the most exciting development is how this AI-powered approach is accelerating diabetes research itself. Traditional studies might take decades to identify environmental risk factors. AI can analyze existing TEDI data to generate new hypotheses in months, then guide targeted follow-up studies to test these predictions. The success of AI in the TEDI protocol is also inspiring similar approaches for other childhood conditions. Researchers are launching AI-powered longitudinal studies for childhood cancer, autism spectrum disorders, and allergic diseases. The TEDI model is becoming a template for how AI can transform preventive medicine across pediatric healthcare. Looking ahead, the technology will only become more powerful. As genetic sequencing becomes cheaper and environmental monitoring becomes more sophisticated, AI will have even richer datasets to analyze. Future studies might incorporate continuous glucose monitoring, environmental sensors, and real-time microbiome analysis to create even more precise prediction models. The TEDI protocol represents something remarkable, the transformation of a devastating childhood disease from something that strikes without warning to something we can see coming years in advance. AI isn't just changing how we treat type 1 diabetes, it's changing how we think about disease prevention entirely. This is just the beginning of AI's revolution in preventive medicine. We're witnessing the emergence of a healthcare system that doesn't just react to disease, but actively prevents it through intelligent prediction and personalized intervention. The children enrolled in TEDI today are pioneering a future where AI helps ensure healthier tomorrows for generations to come. Thanks for watching AI Radar. If you want to stay updated on how artificial intelligence is transforming healthcare and other industries, subscribe and hit the notification bell. Check out our next video where we explore how AI is revolutionizing drug discovery and potentially cutting decades off the time needed to develop new treatments.